Get started. Aloha, everyone. I hope you all had a nice lunch break. Thank you for joining us for this panel on healthcare for homeless, understanding the process. Just a couple of housekeeping items. Questions will be answered at the end of the presentation if you do have a question. And also, as a reminder, this conference will be recorded for your reference. So let's please welcome Puanani, who is the Healthcare Branch Outreach Manager for MedQuest Division, and Meredith, who is the Assistant Administrator, Deputy Medicaid Director for MedQuest Division.
Aloha.
Aloha, everybody. So glad that you're joining our session today. We hope you've enjoyed the full day that's been dedicated to the work you're all doing and interested in. We're really delighted to have been asked to join today and just give really some basics. That's our full intent, is to just give some basics. So apologies in advance if some of what we're discussing might feel like, yeah, I already know that. But we wanted to make sure we're just reinforcing and that we leave some time at the end if you have any questions. And Puanani is my forever partner in crime, so I'm grateful to her to be with me here today. And yeah, why don't we go ahead and go to that next slide, Puanani. Oop, one more back.
Wait, sorry. Sensitive computer.
Sensitive computer. All right, so we wanted to start off by just giving you a sense of where is MedQuest right now in terms of coverage for our people. And so this chart that I'm sharing with you right now will show you that currently, and these are numbers that we updated just this week, we're covering 432,050 lives here in the state of Hawaii. And then the other number you see at the bottom of the graph, which is 327,119, that's kind of a more steady number that we were at before we started feeling the impacts of the pandemic in March of 2020. So when we look at the difference between those two sets of numbers, we can appreciate we have experienced a 32% increase in Medicaid enrollments since March of 2020. And that's a total of an additional approximately 104,931 people. So wanted to demonstrate that we are way up there. And we're going to talk a little bit later about what you folks are already aware of. There's an existing Health and Human Services public health emergency. And part of that public health emergency allows us to keep everybody enrolled who was enrolled since March, no matter what. There are very few exceptions, like if the member passes away, if the member moves out of state, or if the member gives us a call and says, hey, you know what? I'm back at work. I have my employer sponsored coverage. Thank you so much. I don't need my MedQuest coverage anymore. Those are the three circumstances where we can terminate somebody's Medicaid. Otherwise, we are not terminating during the public health emergency. And that's part of the messaging that we wanted to talk about with all of you today. And we'll get into that a little bit more. But I just wanted to seed it while we're on this slide so you can understand that increase in the context of what we call a maintenance of effort during the public health emergency to not disenroll folks. All right, next slide. And then I wanted to show you what that looks like county by county. Everywhere, increases everywhere. But as you can see, we're measuring everything from that March 2020 date in order of looking at increases. So starting up with Kauai County, you can see a 35% increase in that time, and a total of 26,010 lives covered on Kauai. Then we go to Oahu and we see a 33% increase in that time. And on the island of Oahu alone, 262,716 lives covered currently. Maui County has seen a huge 38% increase during this time, and a total of 55,190 lives being covered. And then Hawaii Island, a 26% increase. So that's a total of 88,134 lives on Hawaii Island being covered. And keep in mind, we're benchmarking this from March 2020, but for Hawaii Island, if you go backwards a little bit more, you would see an additional impact of the lava inundation that had happened before we started feeling the effects of the pandemic. Next slide, please. All right, and I'm going to turn this over to Puanani and put myself on mute.
Thank you. Okay, aloha everyone. So these are just some terms and definitions. I don't want to belabor and read them all to you, but as you know, government and state tend to have a lot of acronyms. And so these are some of ours. And as we go through the presentation, we will say them out to you if there's an acronym, just so we can be clear, because a lot of people get confused on what acronyms mean and sometimes they're duplicated. So we do have them here in our PowerPoint deck for your reference.
Puanani, try to go back real fast. I want to
Okay.
call out, even when Puanani and I were doing this this chart, because the alphabet soup can get to be crazy, as all of you in this room know, because you work around this world, right? And I want to call out the SD small OH toward the bottom. It's the third bullet from the bottom. Social determinants of health. We also call it social drivers of health. A lot of times when we see SDOH we think, oh, it's State Department of Health. It can be a little confusing. So that one in particular, I just wanted to recognize we're so well aware that our social drivers of health really do impact and influence, and especially in the context of this particular conference we're all at today. So I wanted to just focus and call that out in particular, as you might see that in other documents. Sorry, Puanani, go ahead.
No, thank you, thank you. So we just wanted to go over a little bit about what is Medicaid, because a lot of people are confused. Medicaid, Medicare, is it all the same? What does it mean? Medicaid is a federal and state partnership that provides health coverage to children and adults who meet the eligibility threshold, and also includes other vulnerable populations such as pregnant women, former foster children, and those who are aged, blind, and disabled. Again, Medicaid is different in every state. So what may be covered as part of benefits and who may be covered in the state of Hawaii may not be so in other states. So when seeking questions about Medicaid, you should always ask the specific state in which one is covered.
And this was interesting, yeah, Puanani, because we were just at our Medicaid Health Advisory Committee meeting, and someone during that meeting shared, it can be confusing when you talk about Medicaid with friends and relatives who may live elsewhere, because we're used to one set of benefits and services and processes here. But like Puanani said, it's different in every state. That can be so confusing. And she was sharing the story of her mom, who she's trying to help, who had services here but moved to Florida. And she's trying to help connect her mom with services in Florida. And she found it to be really difficult because she was speaking a different language from the Florida program, right? Assuming whatever we have here, they also have there. And it's just not necessarily the case when we're talking about Medicaid programs. So, and that, I'm sure all of you maybe have experienced that when you're working with people, you've had the experience of people who are coming from elsewhere with a whole notion of what Medicaid offers. And it really does start with like, hey, let's clear out the cache, like start fresh. Here's what Hawaii Medicaid is like.
And before I move on, so the federal partner, obviously, with us through the Medicaid program is the CMS, or Centers for Medicare and Medicaid Services. And obviously for our state, it's the Department of Human Services MedQuest division who administers this program. All right, so all of our medical services that MedQuest provides will be coordinated and provided through our QI health plans for our Hawaii residents, and they cover a real plethora of services. We cover primary and acute care, behavioral health care, home and community-based services, along with long-term care. And every member will be assigned to or may choose a primary care provider. And members who have chronic health conditions and or long-term care needs, they will have a health coordinator. Previously, I believe the health plans were using service coordinator as a term. And this new year, the terminology will be a health coordinator. So we should make note of that because people may not pick that up right away. Some basic eligibility criteria for individuals and families applying to Medicaid coverage should know they should be a US citizen or qualified non-citizen and or a COFA resident in the state of Hawaii. Since December 27, 2020, when the Omnibus Act was signed into law, it basically corrected an administrative error for our COFA residents in our state and throughout the states. And these are for those citizens or residents in Hawaii who are from the Federated States of Micronesia, the Republic of Marshall Islands, and the Republic of Palau. So they are now eligible for Medicaid effective as of 12/27/2020. One also must be a resident in the state of Hawaii. You must also be able to furnish a social security number, not be residing in a public institution such as Hawaii State Hospital or in any of our public safety institutions. And you must provide documentation of citizenship and identification if it is needed. We will let you know if things are needed or additional information is to be submitted.
And I appreciate, Puanani, that you're explaining that in that way, because one of the things, and we know especially when you're dealing with a houseless population, it's not like everybody always has their documentation, all their paperwork, right, in hand. And we want to be sure that the message is received loud and clear, like apply anyway. Just apply. We are happy to take an application based on self-attestation. And we're able to do that because once we get all of the information, the application, we can go ahead and check all the information against federal hubs, like your social security number and all of that. And as long as it passes that check, like, oh yeah, this person who's born on this date and has this number, then there could be no need for us to ever have to see the physical card. So we hear stories sometimes from the community like, oh, I knew I needed Medicaid, but I couldn't find my papers. So I was waiting to find my papers before I apply. And so we want to really make loud and clear the message, like, please don't do that. Please just apply. It could happen if there's a mismatch, right? After we run the application, if something bumps out and says, oh, that doesn't match, at that point, then we may reach out and say, you know what, we can't validate that. How can we work with you to get the documentation we need at that point to do a validation, since the federal hubs can't validate it for us? But that would be step 2. So just putting a plug in for that of apply, don't wait.
Yep, thank you for that, Meredith. All right. Oh, what's happening? Okay, I'll hand it back to you, Meredith.
So Punani and I talked story about, like, this is a really dense slide. Do we even want to include it? We went back and forth and we're like, you know what? Let's just show it to you guys just as a talking point. Please don't become overwhelmed by it. I know it's a lot, but I wanted to, we wanted to show you, because this question comes up a lot, who's eligible? Like my neighbors, I'll be walking my dog, they'll be like, hey, Meredith, you work at Medicaid, right? So what? How much money can I make? And then I can still be eligible. And I'm like, okay, wait, it's not so simple. I wish it was, but there's a lot of factors. So as you look at this chart, on the left-hand side, you're gonna see HH, it stands for household. So household size. So if you're a single person, then you can read it across the row. For single people, these are the thresholds, right? So if single adult, you can make up to 138% of the what's called the federal poverty limit. This is a rate that's set nationally. It's a little higher for both Hawaii and Alaska. So we have our own special rates. But for example, if you're a single adult, you can make up to, this is the limit, the $1,705 a month. So it really depends on who we're talking to, and that's for an adult. But then, as you can see, if you go to the next 3 columns, child, child, and child, there's a different threshold depending on the age of the kid. But what's important to recognize is, again, household size, and you're going to see that for kids, the eligibility is much higher, much, much higher. So all the way to the right is you're going to see S-chip child. This is the general standard we use. So, you know, the internal guts, the three columns in the middle that say child, I would steer you to not pay attention to that. That's more for internally how we classify different coverages. The thing for the community to focus on for kids is this right-hand side column, right? So you can see, I'm going to go to a household of four, and you go all the way across. That household can make up to $7,951 a month, and the kids can still be eligible. So that's 313% of the federal poverty level. So as you can imagine, when we talk about adults versus keiki, a lot of times, so say my household of four, our household falls like in the 250 percentile of the federal poverty limit. That would mean my keiki could qualify, but maybe I don't, but my keiki could. So we tell people, and again, you're going to hear this message throughout, apply, apply, apply. The key is let us do the eligibility work. It's better to apply. We hear also in the community from folks who are like, oh, I applied for Medicaid a long time ago and I'm not eligible, so I didn't bother. It's like, try again, try again. Maybe you are, maybe you aren't. I want to point out also the pregnant woman category here. The other thing to know that when pregnant women apply, their eligibility threshold is also higher than the normal 138. It's 196% of the FPL. So again, for adults who applied and they're like, oh, sorry, you make a little too much money. But if you're Hapai, apply again because you might now be eligible. The other thing I want to say about pregnant women is your unborn children are calculated into the household size. So when you look at household size, depending on the number of babies you're carrying, so if I'm Hapai, a single mom, I'm Hapai, and I'm carrying twins, that means my household size is 3. Okay. So we'll just like pause for 30 seconds, let you kind of take in this slide. These materials are going to be available to you, so you'll have it to refer back to. And then I left Puanani with the next slide. It's way more complicated, and so we'll have the expert Puanani address this slide.
No, not an expert, but this is our NAJAI accepted income standard levels for 2021. And it's basically for those who are aged, blind, and disabled or medically needy. And it also includes our Medicare savings program. So as we age or are blind or disabled for our residents here, these are the income standards that they must meet in order to be eligible for various categories of coverage or programs. From our SLIMB to the right, the SLMB, QI1, QDW1, these are all our Medicare savings programs, and we have a lot of information on that. So these programs, we, Medicaid, help cover some of your costs and or premiums for your Medicare Part B, say, and other Medicare services, but you do not then qualify for Medicaid. So if you're not qualified or eligible for the Medicaid side, if you're in the aged, blind, or disabled category, you may also, although you may not be qualified for the MedQuest benefits or the Quest integration benefits, you may qualify for some savings on the Medicare side, which we can help with. And so if you have any questions, this is where assets come into play. So with the inception of the Affordable Care Act, any adult 19 through the age of 64, it is now the only thing we're looking at really is your income, your household income, okay? Assets are not taken into consideration when you're within those ages and you are a healthy individual and family. But if you are in the aged, blind, or disabled category, then assets do become part of the equation in looking for at the eligibility determinations. So we would want that piece of information as well. So there's the asset limits here. And again, like Meredith said, don't get tied up or don't get paralyzed in the, am I eligible? Am I not eligible? Submitting an application is the first step. It also solidifies your date of application. So if in the whole process, you are determined eligible, you will be determined eligible from the date that we received and started processing your application, as opposed to if you waited 6 months and then you really were eligible, you could have had benefits 6 months ago. So turning in those applications, providing whatever information we're asking for, we will tell you along the way by way of notices, either in the mail or via your email if you create your own account, what else is needed to make a determination.
And another change that's been really community positive, and I'm so happy about it. And Punani, do you want to talk about the retroactive period moving from 10 to 90 days?
Oh yeah, so again, oh God, this was changed last year, the year before. So we used to have a retroactive period of, if you had medical services in the past 10 days, we could go back 10 days and provide you coverage if you were in fact found eligible. And now we have changed that to 90 days or 3 months. So 90 days, we can retroactively cover someone from the date of application. So yeah, that's a big change, and it's helped a lot more people.
Huge change. And because sometimes you're dealing with people and they're like, they don't want to do the hassle, like, I don't want to apply, whatever. Yeah, I had to go to the ER, but that was 2 months ago and I'm fine. But for all of you and all of us to know, right? Like, no, but there's still, it would be good to have that person take the time and apply, because there's potential to have that, if they're eligible, to have that covered as well. So really good incentive to have people apply and not count themselves out of coverage.
All right, so moving on. This is a new thing for Medicaid that we just got. Meredith, do you want to explain this?
Sure. So this is another really community positive development. So happy about this one. And I think many of you may have already heard about this, but perhaps not everybody, because it is relatively new. There was this barrier that existed for working individuals with disabilities. So what would happen is their income, if their work started to have them exceed the acceptable income for their eligibility, they could lose eligibility. What happens now, and you'll see this in the second bullet, the income limit is now just like it is for everybody else at 138%. Going back to that federal poverty level chart we showed you before for adults. It used to be, if you were in the disabled category, you were capped off at the 100% of federal poverty level. So the difference is, you can see this, that 100% would be about your monthly income had to only be 1,235, couldn't exceed that. But with this new advancement, now it can go up to that full 138 or 1,705. So really big, important advancement for those of us in the community who are dealing with disabilities and their ability to maintain some kind of employment. And the asset resource standard has also changed. So you can see that change here to $7,970 in assets for a household of 1, or $11,960 for a household of 2. And great bullet premiums or other cost sharing charges, none. So again, really good to know. And I hope that's welcome news for those of you who weren't aware yet.
All right, so how do we apply to Medicaid or MedQuest, the MedQuest division? Again, I just want to note that if our beneficiaries were on Medicaid as of March 18th, 2020, or have become eligible since then, their Medicaid coverage will not be terminating during this period of national public health emergency. Meredith mentioned it earlier of why our enrollments have grown so phenomenally. This is the reason why. And when the national public emergency ends, we will begin an unwinding and renewing process to make sure people are still eligible or not eligible and helping them through that transition. But how one can apply to MedQuest is you can, okay, I'm sorry. Going back to our current pandemic, again, we continue to serve the public and our residents in the state of Hawaii through, distancing and PPE and being mindful of the coronavirus and making sure everyone is safe. Many people have learned how to do virtual, using the phone and that kind of thing. So again, our first line of best way to apply is online. But again, many of our population and obviously many of our houseless population and residents in Hawaii don't have access to online services. So if that is not a way that they can apply by calling our Enrollment Services Center. We have the Oahu number and a toll-free number. They can also drop off or pick up a paper application and complete it there. But by far and the fastest and easiest way to get a determination and submit an application is online. And that's where we encourage our community partners to work with our healthcare outreach branch. If you would like to learn how to do that or have access to our Navigator portal. But again, we encourage online. It is the fastest way. And these are a list of our community partners. You can find them on our website, which is also listed on our slide. And these partners are all contracted and or have written agreements with MedQuest, the Department of Human Services MedQuest division. We, our healthcare outreach branch, train and certify on an annual basis and provide guidance and support to all of our community partners throughout our state in helping to enroll the residents in the state of Hawaii for health coverage, whether it be on Medicaid to MedQuest or with the Affordable Care Act through healthcare.gov on the federal marketplace. So again, this listing is not only available here, but also on our website. And then if you have any questions or would like to become a community partner and you have questions about whether that's really going to fit for your organization or not, please give me a call or shoot me an email and we can talk about those options and see if that might work for you or would be a good option. So please feel free to contact me.
But not during this presentation, because then that's going to throw you off. But you're going to put your phone number right there.
Yeah, my phone number's on there. So I'm sure that these resources will be shared with you after the conference today. Some of our application tips. Okay, so keeping in mind, who do you include in your family or on your application? Many of us here in Hawaii live in multi-generational homes, so it's not everyone in your hale. It is who you have on your taxes, your spouse, your dependents. Who do you claim and who is included within your taxes when you file taxes? This is who you are going to include on your application. What are you going to include for income and things like that? If you're receiving unemployment benefits from the state, we will count that. However, if you're receiving federal unemployment insurance benefits, those particular incomes are exempt. All right, we do not count it, but it's good to disclose and we will move it around as appropriate. Applicants who are aged, 65 years or older, disabled or blind, or are receiving Social Security income, Social Security benefits will also need to include an 1100B form, which is a supplemental form that declares one's income and assets. So we'll let you know when you submit your application if in fact you need these things. But typically someone who is 65 or older, disabled or blind will also need this accompanying form. So if you know you're working with somebody in that category, automatically it would be good to just have that form and submit it with the application. Also, for any qualified non-citizens, immigration documents, including documentation with entry dates to the US, is also very helpful. in the event that there are other programs that you may be eligible for. Also, for our COFA clients, a current passport and or I-94 it would be needed as well. And then just to reiterate, who do you include on your application? Once again, it's those you include on your tax return. If you're single and you're living in a household with your aunties, uncles, nieces, nephews, it's just you and you have no dependents, you're not married, you would just put your own information on the application. If you live in a multiple house with 10 roommates, but you have no relationship to them and you're all just single living together, that's fine. You would just put your own application, your own information. You don't need the other 10 roommates you're living with. Okay, so for MedQuest and Medicaid, it is who is really within your tax household dependent status.
And we understand that from a community level perspective, this can be really challenging to understand. Why is it different from BESD when I need food stamps or financial assistance? They want me to include people in my HALE, not just people on my tax return. And so I'm saying that not because I have a good, solution for that, but to explain there are two different federal regulators. And so these requirements reflect what's required by the various regulators. So for our BESD programs, our SNAP and TANF programs, it's Food and Nutrition Services, Department of Agriculture. And then for MedQuest, it's the Centers for Medicaid and Medicare Services, or CMS. And so that's why there's just that difference. But I acknowledge that it can be a little tricksy on the community level, especially for organizations who are helping people when you're trying to help them apply for everything and understanding, oh yeah, Medicaid, think about who is on this person's taxes or who would be, who are the dependents in this situation, not necessarily who they share a dwelling with.
Great. And so this is also very important, and we just want to communicate that having a current mailing address is essential for continued coverage with MedQuest. Many times, and especially on an annual basis, people, our applicants and our beneficiaries will go through a renewal process. Sometimes we need additional information when our systems are doing the renewal and they're bumping up the state against the state and federal hubs, and there's some data matching issues or some mismatch of figures and that kind of thing. Sometimes we need information, and if we mail out something to requesting in more additional information or for the beneficiary to contact us, and we get returned mail, they run the risk of having their coverage terminated. So looking for other options for mailing solutions, friends, other agencies, shelters who may help with this, because many are versed in that unfortunate situation where you need to receive certain things and be able to communicate with the MedQuest division. So really important if we are moving, and very challenging, right, for our houseless population. If you're moving, but you at least can still get your mail from somebody or somewhere, then at least that's some consistency and we can keep communicating with you. So where possible, please have the residents you work with and the people that you work with update information as it changes, and reiterating that to the people we serve helps support that and get them to remember, because it's rough, right? A lot of people, that's the last thing they remember when they're being in crisis, moving around from place to place, is remembering to change these things. But I do work with some very good families that I've considered my friends after all these years, and they are homeless throughout the state, and they call me when they have issues. They call me when they receive notices and to explain, what do I need to do? They communicate with me with their cell phone, they email me. So there are ways, because I work with many homeless families every year to make sure their coverage is okay. And so there is ways around things, and communicating with them and helping to reiterate that with them reminds them that they also have to communicate with us as well. So it does happen. It just takes some reinforcement and reminding. Also, if you do an application online, choosing a health plan is now an option. So this is another good reason why maybe if you're a community partner and you're helping the community apply or would be helping, it might be a good idea to be one of our community partners, and I could help you with that. But this is a screenshot of the link. The left side of the page is the link, and you would go down to the plan selection web form down in the bottom link, and up pops the screen on the right where it says MedQuest Division, confirmation number, first name, last name, residing island, select a health plan. So you could select your health plan at the point of once you submitted your online application, and then you would be put into the plan that you selected. However, if you do not choose a plan upon online submission, one would be auto assigned into a rotation of plans to you. Now, the member who applies, if they become a beneficiary and they choose, they don't really like the plan they're assigned to, they always have the option of changing that. So again, they should change that and notify us within 10 days of being assigned to a specific plan that they really don't want to be in that plan. They want to be in a different plan, and we can help make that happen. But this only happens once. And then after that, there is an annual plan change that occurs typically in the month of October, where one can make a change for a January 1st effective date into that plan change. Sometimes people do have situations where they're going into some sort of treatment facility, or there are health circumstances where there needs to be a plan change. So there are other options for plan changes, but typically this is the way when you are assigned to a health plan and you've been with one would change. Okay. And then if you have any questions on that, we can always help you. These are our Quest health plans that we have. We have 5: Aloha Care, HMSA, Kaiser, Ohana Health Plan, and United Healthcare. For Kaiser, those offerings and plans are only offered on Oahu and Maui County, or Maui, sorry, the Greater Maui Island only. And Aloha Care and United Healthcare, I just want to point out, and I know all of our plans offer special perks and benefits that are really offered by their plans specifically. Aloha Care and United Healthcare are also in 2022 offering basic dental. So good to know, it's not comprehensive dental, it is basic dental. But because those services are sought so often, I just thought I would point that out there. All right, and changes to reports to MedQuest. I'm going to kind of turn this over to Meredith because we have the highlights here.
Sure. And, the bottom line message is changes, please report changes. It's important because, as you saw from that chart we showed you, any change that's going to impact either income or household size requires a redetermination of eligibility. Not right now. I mean, report the change now, but even if you reported a change that would technically make you ineligible, your eligibility is still going to be maintained during this public health emergency. So it's a little confusing, but the fact of the matter is the reason we're highlighting here, all the changes are important, but the contact information is so important because we know that eventually we will be coming up on what we're calling, CMS is calling the unwinding of the public health emergency. You might hear unwinding of the PHE. This slide basically shows you the text of the public health emergency related to COVID. If you read through it, you'll see that, this has been going on since January 27th, 2020. That was the initial declaration of the public health emergency. Public health emergencies can only extend for 90 days at a time. So it has been renewed every 90 days since its first declaration back in January of 2020. We don't have an exact, excuse me, this current public health emergency you'll see was signed off on October 15th. So count forward 90 days. That would take us to mid-January. So we don't know when it comes to mid-January, will this public health emergency be extended again? Will it not be? We do know from CMS that once the public health emergency ends, then all of the Medicaid programs will be charged with this unwinding. In other words, you've had this maintenance of effort, keeping everybody enrolled until the public health emergency ends. And then you have to start to unwind that, which means all of those 430,000 people you saw on that initial slide, you know, the purple line that went up and up, we have to check their eligibility and make sure, okay, are you still eligible? One of the things that's going to matter is our ability to reach people, right? If we can run them through the system, like I talked about earlier, check against the hubs. Yes, you're still eligible. Awesome. The person doesn't even have to be involved, right? It's like, great, they're still eligible, move on. It's really only that proportion of the population who might not, when we run that check again, might not be able to be checked out in that way. We might need more info. You guys know how this goes. We'll send a notice out. If we get a notice back that says, you know, whereabouts unknown, this person is not at this address, we are going to be deploying extra effort to try to find the person. It's not just, oh, we got a return notice, we're going to terminate. That is not how MedQuest is going to be handling this unwinding. We're going to be doing it very thoughtfully, very carefully, and making every effort to reach, which is why, you know, Puanani's talking about the importance of give us the best address you have so we can hope to reach you. How do you say that to a person without an address, without a house, right? So give us an email address that you might check. Do you have a phone number? We're going to deploy every contact we have to try to reach somebody. So that's just our plug and encouragement leading up to the eventual unwinding of the PHE. We really want to be able to reach those we need to reach. Our goal is we do not want to terminate anyone based on we cannot find them. That's the worst case scenario for us. We want everybody who is eligible to remain eligible. And sometimes we have to reach people in order to confirm that. Next slide.
All right, so how does one report changes to MedQuest? They can do it online, mybenefits.hawaii.gov. They can call our Enrollment Services Center and our Customer Service Branch. And they can also complete an 1179 change of circumstance form. Now, again, these forms can be retrieved off of our website at medquest.hawaii.gov. If you scroll all the way to the bottom on the far left, there's a little green box rectangle that says forms. You click on it and you let it scroll for a little bit because all of our forms are in there that are current. And you let that, once it's all loaded, then the form numbers will start to appear, which is why we provided you the DHS 1179 form, which is the change of circumstance form. Not only does this form appear there, but all of the forms that we use will be loaded there. All right, and here is some just resources and references for you. Here's all of our eligibility offices statewide, their mailing addresses, their physical addresses, their phone numbers, and their fax numbers. And if one is not eligible for Medicaid, what do they do? If they don't have any other eligible medical health coverage sources such as Medicare, TRICARE, Peace Corps, any other type of employer-sponsored health coverage, then they could possibly apply to the federal marketplace, otherwise known as the Affordable Care Act. People sometimes refer to it as Obamacare. It is in the state of Hawaii, we are a federally facilitated marketplace, and we use the federal marketplace hub at www.healthcare.gov. One can apply online, create their account, and submit their application. They can also call and apply over the phone with a customer service representative. There's TTY number available for those who need that type of assistance, or there's also in-person assistance with our COCUA and our community partners. So if you remember, I had shown a screenshot of our community partners statewide. There is someone in every county who can help. Mostly all of our federally qualified health centers have somebody who can help apply to the federal marketplace, and many of our other community partners. So again, if you need help with that, please let me know and we can refer them there, or you can go to our website and look up our community partners or refer back to this deck. Let me just remind you, currently at the federal marketplace, we are currently in open enrollment. It began on November 1st and it typically ends on December 15th. Right now, if you apply between November 1st and December 15th, you can start an effective date of coverage as of January 1st. However, the current administration has extended this year's open enrollment period, given the national public health emergency that is going on currently. And they've extended open enrollment through January 15th, 2022. So now if you applied between December 16th, say you just didn't do anything and you didn't have coverage and you're not qualified for Medicaid, so you're gonna go to the marketplace, but you forgot and you missed your December 15th deadline, then you can still apply. But any applications that go into the marketplace from December 16th through January 15th of 2022 won't get an effective date of coverage until either February 1st or March 1st. So it's always a month later, or in this case, it may be an effective date of March if someone chooses a March 1st date. All right, and so just to compare and look at the differences in the federal poverty guidelines and what a household could make. So this chart shows you the eligibility thresholds for Medicaid, as well as the marketplace. The right side is marketplace. So again, there's a vast difference in coverage. And so if you don't qualify for Medicaid, by all means, try the healthcare.gov, because the marketplace offers two different types of federal subsidies: an advanced premium tax credit, which can help lower your monthly premium costs. And there's also a cost share reduction subsidy, which can also help lower the deductibles and your out-of-pocket expenses, such as your co-payments and your co-insurance portions. And without getting that, gets really complicated and in the weeds, but if you need help with that, our healthcare outreach branch is here to help you for that. So please make sure you contact me or any of my any of the community partners we listed, and we can help with that. Okay, so what is Medicare and why are we talking about it? Because a lot of people get confused. Sometimes people start talking to me about, oh, you know, I did this and my Medicaid got cut off and now I don't know. And they told me I needed Part D for drug coverage. And so right away, I already know this is not Medicaid they're talking about. This is Medicare, because they're talking about Part A's and Part B's and Part C's and Part D's. But again, what is it? Don't get it confused. It is very different. Medicare is the federal program under Social Security. So they help to cover those who are 65 and older, those who are disabled and blind. So again, keeping in mind that these categories, you know, if you're talking to somebody in these categories, they may also have Medicaid, but most likely they have Medicare and they're talking about Medicare. And by the way, just noting, Medicare is expected to double their enrollment by 2030 in their current projections. So Community Integrated Services, or CIS, providers can verify Medicaid eligibility and help ensure member records are up to date. So what is the goal of these services? The goal is to promote the objectives of the Medicaid program by improving health outcomes for Medicaid members who need housing. Who is our target population? Any Quest members who are 18 years of age or older. And the health need criteria for this is behavioral health needs, severely mentally ill and substance abuse needs, meeting at least an ASAM level 2.1, and complex physical health needs. And they also must have other risks, which are noted on the right-hand side. Must be possibly risk for homeless individuals, individuals at risk for eviction, individuals transitioning from long-term care facilities back to communities who do not have housing. So again, we are helping to provide these services. And what are the community integration services? Well, these are pre-tenancy and tenancy services that support the members to be successful tenants in housing that is either owned, rented, or leased to that member.
And the health plans that participate in that, just before we close with the reference materials, I just want to say they are heroes. Some of you may be listening and joining in on this conference. We can't see the participants, so I just want to pause and say thank you for the amazing good work you do, to all of our health plans, to the folks in the CIS who are out there on the street helping the people. You're amazing. You're the key to really having us collectively start to make a difference in the lives of the people we're all here to serve. So I know you're out there. I think you're listening, and I just wanted you to know how much we really recognize and appreciate your amazing work.
And so our next few slides are reference information, and we'll also have, we will also be having a slide with all of the housing coordinators, which with each of the health plans coming up. But in this particular slide, we have additional contacts for our MedQuest customer service and enrollment call center. If a member for MedQuest needs to see a dentist, how do they do that? They can call this number. Social Security Administration, if people are needing help with that, here's the number here. And Hawaii SHIP State Health Insurance Program, they help with Medicare, so their phone number is here as well. And here, next is our CIS, Housing Coordinator contact information. So again, we have all of them listed for all of our health plans here, and you can certainly keep these as references. And that is it. Now I think we can open it up for any questions. I did see a lot of things coming through.
Yeah, there
but,
were some. So you know what, because I know we only have like 8 minutes, if you guys don't mind, I'm just gonna like bang them out really fast. So, and I hope it's sufficient. So the first question I see is, do you know how much of that increase, you know, that purple line increase is due to COFA now finally mercifully being able to access Medicaid? So not a huge proportion. What I will say is, because we were MedQuest was already covering the keiki, the pregnant moms, and anyone who is aged, blind, and disabled, they were already being covered. So the additional folks coming on are those 19 to 65-year-old healthy adult, 19 to 64, I should say. So there has been an increase. If we just look within the COFA population, it has doubled on MedQuest. But that extra 104,000 something, that's a much smaller proportion. Most of it is due to, you know, the terrible economic woes we've had, people losing employer-sponsored health insurance and coming, thank goodness, to the safety net that exists of coverage through MedQuest. As our economy improves, we'll probably start to see some of those numbers start to come back down a little. So that's that one. The next one, if one is homeless and does not have supporting documents, how can such a person be eligible? So just apply. So apply, because as long as the person knows their information and we put it in, as long as there's nothing that comes back from the feds that says there's a mismatch, we don't know who this person is, if it goes through, the person, you're all good to go. So that's why we say apply first, because that information, that's what we use our federal hubs for. Puanani, do you want to take the next one? Is how much of the, oh no, sorry, I'm scrolling. How young can a person be to apply? For example, an unaccompanied minor, is it 14 years plus? What is the deal if it's an unaccompanied minor?
An unaccompanied minor needs to have someone who is a responsible adult help them apply. they would have to do the application and be a person, the contact person on that application, and then add that unaccompanied minor to the application and apply on their behalf. But again, it should be a responsible person whom that unaccompanied minor trusts, who you are basically taking responsibility for to make sure their notices are read in a timely fashion. So whatever MedQuest may be requesting from them could be answered or provided the information in the timely before the deadline. Usually our notices, if we're requesting something, there's usually a time frame and a deadline date, due date that's done. So with an unaccompanied minor, that is the way it has to be. So until you reach, basically the age of 19, you could do your own application. Again, there are some different circumstances where it could be 18, but I would then check with us to make sure and give us the circumstance, because there are certain circumstances where one could apply at 18. But again, if you're under that, again, a responsible adult who has trust and is going to be helping that unaccompanied minor through the process and helping to support them through their medical process can be the one to do the application, but they would then be the primary person on that application as not applying, but basically you're the contact, and then that unaccompanied minor would be the second person on that family application, and they would be the one applying for MedQuest.
Thank you, Puanani. All right, the next one, easy peasy. Do we have something online about assets? Yes, so if you go to the Hawaii MedQuest website, so just Google MedQuest Hawaii, it'll get you to our website. On the website, there's a button for forms, and you're gonna find all of our many forms there, but the one that will walk you through, it's a form for how you declare assets, and there's also an instruction sheet. It's called the 1100B, so 1100B, and that form has all the information you need for what counts as an asset, how do you use the form for it. So you'll find that there. And I'm trying not to miss any of these. Oh yes, our plan, we need to work with all of you, which is why we wanted to take some time during our presentation to sort of seed for all of you this eventual unwinding of the public health emergency. And it will truly have to be a kako thing. We want to work with all of you. For sure, our health plans are key in this, and we'll be working with them. The goal is, again, to keep everybody who's eligible enrolled. And for those people who are not eligible, how do we very carefully help people transition to insurance that will work for them? We do not want anyone to become uninsured as a result of the unwinding of the PHE. Puanani and her healthcare outreach branch team are expert at helping people transition over to marketplace coverage. So for sure, we want to be all working collectively to make sure everybody is insured where they're eligible to be insured. How often can a family change their PCP, like their pediatrician? You can call your health plan and talk to your health plan about any time you want to change. So there's a difference, right? You can change your health plan. Puanani went over the 5 plans. You get an opportunity once a year during the month of October 1st to 31st, you can change your health plan. But once you're in your health plan, you can always reach out to your health plan and talk to them about any need to want to change a primary care physician. And then, oops, I'm trying to see if there are any other questions. Puanani or Ria, do you see any others?
Yeah.
Not see any, sorry.
The last question is, are there any health plans that offer midwife services?
You know, that is an excellent question. I'm actually not sure off of the top of my head, but we can definitely get back to you on that. Unless there are folks from the health plans present who want to, you know, go ahead and respond to that yourselves. And if not, I'll be sure we give that question back to the teams here.
Awesome.
And lastly, I know you can't see it because I have a background on, but we have a QI Quest integration decision booklet full of a lot of this information that's very, very handy. You can always, if you're near an eligibility office, you can stop by and pick up a brochure. If you need brochures for your outreach, let us know. We can get them to you. Give me a call, email me, and we can get these out to you. We do have the latest one for 2022, and it highlights all of the health plans and their special services, their contact information, all of the benefits that MedQuest provides, what to do when certain situations arise. So it's a plethora of information, always handy, and I always have it handy on my desk when I get questions for things. So let us know how we can help.
Yes, we are right on time, and thank you so much, Puanani and Meredith, for your knowledge and presentation. I hope you all retain the information. If not, this presentation has been recorded and Partners in Care will distribute it for your reference. Thank you, everyone. Have a great afternoon.
Thank you. Mahalo.
Mahalo.